Good evening, good afternoon, and good morning from the different regions that you are joining us this evening. On behalf of the Voice for Change Partnership, I wish to welcome you to this session. My name is Mary Njuguna, Advocacy Advisor, Food and Nutrition Security, also working with the Voice for Change Partnership, and will be moderating this session. So today we will hear how civil society are adapting their evidence-based advocacy activities within the COVID epidemic crisis. We see how they're making efforts to contribute to an inclusive recovery during the crisis. And as we have seen it, COVID-19 has caused significant adverse effects on people's life, and in fact, all people, but more in particular, vulnerable communities that are constituents of civil society organizations and whom we work for. In the context of advocacy and civic space, the main protagonists, the state, the non-state actors, have not been spared either, leading to disruption of agendas, and issues and priorities are completely changed, and especially with resource allocation. So how are civil society finding their footing? That's what we'll be hearing later on in the session. As a way of introduction, Voice for Change Partnership is implemented by SNV, IFPRI, civil society organizations, and the Dutch Ministry of Foreign Affairs, including the local embassies. The Voice for Change works with 52 civil society organizations across 6 countries: Burkina Faso, Ghana, Honduras, Kenya, Indonesia, and Rwanda. The project applies an evidence-based approach, meaning that civil society are accompanied by research institutions. In this case, IFPRI has been very instrumental in the area of food and nutrition security. The idea is to be able to deliver reliable and relevant data that is attractive to policymakers. The project is focusing on food and nutrition security, energy, as well as water and sanitation for hygiene. In our lineup today, as you can see on your screen, we have various speakers. Our guest speaker is Jung Helderhuis, Head of Civil Society and Education Division, Dutch Ministry of Foreign Affairs. The civil society representatives are basically going to be sharing with us their frontline experiences, and they will use examples from the nexus of food, water, and energy, and will cover experiences from different countries. Eugene Rwabisira, Executive Director, Rwanda Development Organization, will be focusing on food and nutrition security. David Njugi, Executive Director, Clean Cooking Association of Kenya, will bring to us their experiences as they address the reintroduction of VAT into renewable energy technologies in Kenya. While Kwame Owino, Executive Director, Institute of Economic Affairs, will also demonstrate how his organizations and their partners on the ground have been refocusing priorities, especially related to water and sanitation for hygiene. We have 2 discussants, Dr. Nicholas Minot, Deputy Director, Markets, Trade and Institution Division at IFPRI, and Micah Van Jeneken, Chief Executive Officer at SNV, and they will be responding to the presentation of the civil society. We've been waiting to get Jeroen on board. He's had challenges. We'll now he's had, yes, I'm informed that he has technical challenges joining. We hope that he will still be able to join before the end of this session. So we will now proceed to listen to the experience of civil society organizations. Please note that the presentations are pre-recorded We invite you to look at the Q&A and please present your questions there as each presenter is presenting. The presenters themselves are live on this conversation, and towards the end, as we have the question and answer session, you will be able to interact with them directly. So now I invite Eugene Rubisira, Executive Director, Rwanda Development Organization, RDO, to show us how they have been responding to the COVID scenario within the food and nutrition security in Rwanda. Thank you.
Thank you very much for your audience. My name is Eugene Rubasira. I am representing Rwanda Development Organization coming from Rwanda and part of the Voice for Change partnership. I am going to share with you the civil society experience in adopting the evidence-based advocacy. During the COVID-19. My organization's mission is to empower partner communities, including those vulnerable, to improve their human capital, achieve food and nutrition security, and establish market linkages in a sustainable natural environment. Our focus of involvement in the Voice for Change partnership is that there is a need to develop an evidence-based argument for a multi-stakeholder approach to tackling malnutrition. But in this regard, RDO's role is to advocate around budget allocation and expenditure in the areas of food and nutrition security. Then our political influence as RDO is that RDO participates in different sector working groups and review meetings at national level where policies and strategies are discussed, developed and reviewed, and that's where our contribution to influence politically comes in. Now let me take you through the effects of COVID-19. The Voice for Change partnership has been advocating to improve food security and nutrition. One of the effects of COVID-19 is complete lockdown that hampered the movement of people and goods. In such a situation, there was limited supply of foodstuffs, limited choices of food, and inability by some people to buy food due to loss of jobs. These are especially the wage earners. Because of vulnerability of some people, government gave food supplies with no consideration of nutrient content, just to make people feel their stomachs and make sure that they eat irrespective of the nutrient content of the food supplies. Then here, the supply of animal proteins was minimum as there was short supply of feeds and the markets were curtailed. What were the opportunities during this period and challenges? The opportunities was that because of social distancing and hence no public gatherings, CSOs resorted to using media, including radios, for public dialogue. This gave open opportunity for citizens to make call-ins to air their views without fear, unlike in the open room where they could not talk openly as they would when they are not being seen by the administrators around. However, there were challenges as well. Getting policymakers and coordinating them was difficult due to limited movements that we could make as CSOs, and the involvement and the leaders' involvement in food supplies and essential necessities did not give them time to listen to the CSOs, as they could always say they were very busy. What was the adoption of evidence-based advocacy strategies? The strategies we used is the use of articles in the media to advocate for increased budget in food supplies, for nutrition, reminding the government to consider nutrition for the pregnant, lactating mothers and young children while supplying food to vulnerable groups, because by then while they are supplying the food supplies to the people, they were supplying without any consideration for nutrition, just support people to get something to eat, regardless of the nutrition content. Then here we are reminding the policymakers to increase budget for food and nutrition security in the following budget cycle. And in this regard, I am glad to mention that in the current budget cycle, the government increased budgets for Minagri, which is the Ministry of Agriculture, by 30 billion, equivalent to 30 million USD. And I think we contributed to this one. This is packaging of advocacy messages for publication through local media, social media, and diffusion through YouTube for wider audience. Because of the curtailed movement of people and goods, we resorted to the use of social media, and then whatever evidence we generated, we're using the diffusion mechanism using the YouTube for wider audience. Like other CSOs, we did the buying of airtime on radios and TV for topical discussions, making reference to facts from the evidences generated. This, we didn't do it in isolation of other CSOs, but we were working together as CSOs on ways for change. The recommendation I would make to this effect is that there is a need to continue with the evidence generation, because it's only then that the policymakers can listen to us with the evidence. We select the appropriate mechanism for dissemination of evidence according to the targeted audience, because not a single approach can be meaningful and reach as many audiences as you would want. And then with that, we build synergy with others to complement efforts. Not a single man can be able to make it alone. So in conclusion, I say that against all odds, together with determination, we can make it.
Thank you, Eugene. Thank you for sharing how RDOs and CSO found your footing during the crisis, and even going further and being able to influence good nutrition in the food distribution that has followed the onset of the crisis. We've also heard how you've maintained focus, especially on budget tracking, and it is quite interesting to see that even within the crisis, you've been able to contribute to influencing budget allocation for the agriculture sector. Also very interesting what you raised, that the fact that people can now meet online is an advantage, and that through media, people then, communities that would have been inhibited in making their opinions during open public participation can now happen online, and that has continued to work well. So thank you very much. We will proceed to hear the next presentation from Kenya. This is by David Njugi. David Njugi is Executive Director, Clean Cooking Association of Kenya, and they will share with us how they have been able to intervene, especially in the impeding reintroduction of VAT on renewable technologies. We will hear how they are interacting with that particular dialogue as it is ongoing. Thank you.
Thank you very much for your audience.
So my name is David Njugi, the Chief Executive of the Clean Cooking Association of Kenya. And I will be sharing with you during this webinar the civil society experiences in adopting evidence-based advocacy specific to the Clean Cooking Association of Kenya. This, of course, is with the support of the Voice for Change partnership with the SNB. Next slide. So the Clean Cooking Association of Kenya is a sector association representing stakeholders in the clean cooking sector. We have 23 members from various sectors, both in the public and the private sector. For the public sector, we also have representation from national and county governments in the country. Our mission, as stated, is influencing a sustainable, a suitable market environment and capacity development of our members and stakeholders. to cause the universal adoption of clean and efficient cooking solutions in Kenya. And our focus through the Voice for Change partnership was to strengthen the enabling environment to scale up adoption of clean cooking in Kenya through capacity development, both at national and county level, and also using community champions, having an enabling environment through policies and regulations, and making sure that there is evidence to back up our advocacy. Next slide. So the COVID-19 has had effects to the sector and to our engagement and work. And I'll just highlight them. There have been shift in government budget allocation to COVID-19 prevention, which has definitely affected the sector. The economic recession, which has resulted in the introduction of VAT on clean cooking products, the delayed action on sector policies, regulations, and standards that we engage with government. There has been limited movement due to lockdown, which has limited the scope of business and access to markets, reduced liquidity and viability, which has reduced adoption of clean cooking. We've also experienced increased support to businesses from various partners, and also opportunities that have come up to support our businesses during the pandemic. The next slide. Of course, the pandemic has come with its challenges and opportunities, and then I'll just run you through that. There has been delayed sector engagement, especially due to limitations of physical meetings, delays in county engagements, influencing policies, and of course our activities and budget making that has been affected. We have a very important committee called the Interministerial Committee on Clean Cooking, which has been delayed and so far not been able to convene even virtually, which is an important committee that coordinates activities and to help various departments and players in the sector to prioritize activities in clean cooking. We've also seen new sector marketing and financing opportunities to cushion, especially to cushion the sector from COVID-19 threats, which I think has also continually being rolled out. We've also seen support to the sector on new marketing models and business strategies, where businesses are being advised and trained on how to adapt their marketing models and business models to the new reality of COVID-19. We've also seen an improved engagement and coordination with other stakeholders in the sector. We've seen additional players coming into the sector to support the sector advocacy, and also increased government awareness on the cross-cutting nature of clean cooking, since it affects environment, health, and livelihoods. Next slide. Of course, we are trying as much as possible to adapt to this new reality, and our advocacy has been adapting over time. We are still learning, and one of the ways we've learned and adapted this is adapting our advocacy messaging on impacts on household air pollution on COVID-19 pandemic. As you know, household air pollution affects our immunity, and as such makes households or people susceptible to the disease. We've had a special campaign to counter VAT reintroduction on cook stoves, and one of the messages that we've been trying to push out there is on the household air pollution and its effects. Use of media, print and social media, targeted to the general public, but more on the policymakers, the government, and other players in the sector. We've also been convening the sector virtually through webinars. Both governments, we've been able to bring government, the private sector, and other development partners together to discuss sector solutions to COVID-19, and of course our advocacy, strengthening coalitions and new partnerships, as I mentioned earlier, to advance the sector advocacy. We've now been able to partner with the Access Coalition, which is an international coalition of partners who are in the renewable energy sector, Foundation, HIVOS, the World Wide Fund, SIF Kenya, CAFOD, and the Kenya Climate Change Working Group, among others, who now come together to support our advocacy, so that we are seen as one, and we are able to advocate and face the policymakers as one voice, which really helps. Then, of course, we've seen continued the sector support through opportunity, sharing of opportunities, and then training, collaboration with partners to help us with this. I think that has really come in handy. Next slide. As we move forward, the COVID is here with us, and it will take some time to get away until we are able to get immunity for this. So a few recommendations from our experience so far is that for our advocacy to be effective, we need to increasingly use media as a channel, and also not only for advocacy, but creating awareness amongst the public and government. Secondly, is adopting virtual engagement platforms to fast-track advocacy, reach, and sector interaction. I think we've seen that it is also efficient, maybe not as convenient, but it works as well. Proposals for more sector funding from government as part of the community stimulus package targeting SMEs in the clean cooking sector. The government has set up a stimulus package, and SMEs have been provided for certain incentives, and I think we need to engage the government to have that enhanced, especially because most of the companies in the sector are small and medium enterprises. And I think to bolster our evidence-based advocacy, we need to enhance and continue collaboration and partnership with research institutions. This year we've managed to engage the Aga Khan University, who will be supporting us in issues of household air pollution, and also creating an awareness, and also engage the AMREF University, who will also be supporting us with research capacity and support. Thank you, and I wish you all good interactions. Thank you.
Thank you. That presentation from David Njugi, Executive Officer at Clean Cooking Association of Kenya. Underlying health conditions, especially upper respiratory health, has been cited as a major factor in the COVID management. In this regard, we commend the work that Clean Cooking Association of Kenya is basically putting into persuading government to remove this reintroduction of VAT on clean cooking appliances, because as a matter of fact, this then would mean that the gains made previously with the clean cooking, and especially protecting women and children, is going to be lost. And it is interesting to see that Clean Cooking Association and other civil society organizations have begun to address this particular issue. So we will proceed and listen to the next presenter. Our next presenter is Kwame Owino. Kwame Owino comes from the Institute of Economic Affairs. He's the executive director there. And they have been working on this project and focusing on evidence-based advocacy in the water and sanitation for hygiene areas. Kwame will share with us how they have continued to interact with government, both at national and sub-national level, and to continue to influence perspectives of advocacy there. Welcome.
Good afternoon, everyone. I'll be sharing civil society experiences in adapting evidence-based advocacy, and more specifically taking note of the challenges that have been posed and the opportunities under COVID-19. So first, I work at the Institute of Economic Affairs, which is a think tank based in Kenya. Our main vision is to achieve prosperity in Kenya through expanded economic, intellectual, and political reforms. And our mission is to utilize evidence to shape decision-making of public affairs in Kenya through various means. But focusing on our involvement in the Voices for Change program, the main part of what we do is that to provide evidence-based advocacy for sanitation prioritization, and budget allocations. The second is budget analysis and training, budget analysis on sanitation and related sectors, and to train partners. One, to comprehend budgets, but also to be able to use those budgets to hold duty bearers accountable. The third is training of county level CSOs and partners on public participation and social accountability. So with the knowledge about budgets and the allocation process, obviously they can hold duty bearers accountable through social accountability tools and mechanisms. And the final one is basically to engage with media for public education, but at the same time to place the agenda of sanitation in the policy eyes of national and county level leaders. So what are the effects of COVID-19 and how have we responded? I think the first one obviously was that government's announcement meant that holding meetings was not possible because of the restriction on movement, but also the restriction of a meeting of more than 15 people. So we moved to holding IEA's public forums have changed to virtual forums. So that's significant. The second was an adaptation, which was basically because travel restrictions between Nairobi and other countries were not possible. So our communication with our partners was through digital means and these virtual forums. We took that advantage to share information using channels that moved to digital. So most of our communication was through phones, through emails, of course, and at the same time sharing work and meetings digitally. And then at the national and county level, public participation processes, which is very, very important for us, were amended. And that means that obviously meetings that took place in the public affairs required people or rather did not require people to attend in person. Government provided new opportunities, but at the same time, we alerted our partners and they alerted us to all forms of participation that government made available. Part of an example is that on the 24th of April, which is 3 weeks after the announcement, we held a virtual public forum entitled Kenya's Legislative and Oversight Measures and Responses to the COVID-19 Global Pandemic. So part of this is public education around the responses the government of Kenya announced, and to alert all our partners, but also to provide an opportunity for all of them to participate in knowledge sharing around what the public decisions, the public policy decisions the government had made. So what are the challenges? Our response is that with these challenges also came opportunities. So we were not discouraged, but we tried to see what the responses that we needed to take advantage of the opportunities that arose as well. So CSOs at the county level, who are our partners, proactively stepped in and received invitations to be part of COVID-19 emergency committees. Every sub-national government, which are the counties in Kenya, was required to form COVID-19 emergency committees, part of which had a place for citizens to participate. And so our partners in the various counties were alerted to this and they participated, bringing in their knowledge and based on some of the analysis that we've done to continue to participate. That's first. And the second one at the IEA up in our office, we received an invitation by the National Treasury to nominate one of us to sit as part of the Committee on the Millennium County Challenge meetings and other key forums. And here, the reason this was important for us is it is an opportunity for us to use it to raise the profile of sanitation as part of the Sustainable Development Goals and as part of monitoring government's commitments and the achievement. So I went off ahead. So what are the adaptations that we made to evidence-based advocacy strategies? I think one of the things that became very paramount is that cooperation, joint agenda setting, and planning by CSOs and local governments has been key, and it was demonstrated in many ways during the emergency. Many things happened, but the fact, of course, is continuing advocacy efforts for water stations, for increased budget allocation. We continued social audits because expenditure was happening, social audits, and to ensure that focus is kept on sanitation, whose significance was highlighted by this emergency. Partners also distributed COVID-19 IEC materials on hand washing and other preventive measures, especially because the place of sanitation once again was elevated. These network members and health workers were trained on COVID-19 by the Department of Health, and the CSO networks engaged in certain COVID-19 sensitization proposals. That included caravan sensitization, radio talks, distribution of posters and information, hand washing demonstrations, pure one-on-one hand washing demonstrations, and social media campaigns on the importance of social distancing, hand washing, and avoiding crowding places. So what are the recommendations? We have 4 recommendations. I'll start with the first, which is, I think the significance of networks, given the limitation on movements and the limitation on congregating, became salient. And this became the time to demonstrate the importance of networks and relationships that are built and to make them stronger so that they can be relied upon to bring about change by distributing responsibilities based on where people were. The second was partnering effectively. I think to take initiative, given the change and the opportunity to participate in various committees, to participate in various activities, to ensure, to realize that the significance of this challenge required work, not only with one partner, but with government, private sector, the media, and many other stakeholders, because of the joint effort that is required to bring this issue to control. Throughout this time, we have realized the significance of advocacy work, and to ensure that advocacy work, including budget analysis and proposals, are developed. This is significant because this season and this challenge, the COVID-19 challenge, emergency rather, coincided with the budget making process. And so we use that opportunity to use government commitments to ensure that we advocated for increased allocations and better use of finances towards sanitation and sanitation policy. And also to harness opportunities that existed, to embrace digital engagements, and obviously the new roles that come with this. So we understand that our new roles require us to be able to be nimble, to react very fast, and to use digital tools to ensure that the messages continue to go forward, to keep our networks, and also to share information. Thank you.
Thank you, Kwame. And you are in the house, so we really appreciate your inputs. And it is interesting how you have maintained presence in the new normal, even as the new normal unfolds, keeping connected with your constituencies, keeping them informed, even as the government was rolling out its new protocols for engagement. And also the fact that you and your civil society partners on the ground have maintained an active role, and especially partnering with the county governments. And also at the same time, maintaining your eye, especially, and voice on issues of accountability, because of course, as you roll out the COVID responses, there are of course many challenges and need to maintain an eye, especially on advocacy, so on accountability. So we'll be coming back to you with more specific questions after this. At this moment, I want to remind the participants, please log into the question and answer slots and post more questions so that we can interact as we go along. At this moment, I will move over now to the discussant. Our discussants for today will be looking at the reflections that civil society have provided, and they will also be looking at how best to continue supporting civil society organizations within the new COVID times, so to say. So I will start off with Dr. Nicholas Minot, Deputy Director, Markets and Trade and Institutions Division at IFPRI. Nick, welcome with your commentary on the presentations of CSOs.
Thank you, Mary. Okay, let me set myself up here. Great. Well, I think this was a very interesting set of presentations. I think in some ways it shows a great variety of different topics and methods and causes that the Voices for Change partnership is working on. We've got WASH issues, we've got clean cooking, and working on food security and nutrition, or food and nutrition security. So that's very interesting to see the range of activities that the program is working on. I think one central aspect of advocacy work is that it needs to adapt to new situations. And, typically there's turnover among policymakers, and so we have to adapt to who is now making the decisions. There's new evidence becomes available. We need to adapt to take that into account in developing our advocacy messages. And sometimes there's new legislation or new regulations that we can take a job or to make use of in formulating the advocacy strategy. But I think that this theme of adaptation has really been taken to the extreme with the COVID-19 situation. And we have all had to adapt in so many different ways. And that is certainly true of the CSOs working on these different issues. I think probably the word adapt or adaptation was almost in every slide. And it's a big challenge. It has been a big challenge. And I think the CSOs, the presentations really highlighted the various ways in which the program has had to adapt to the new situation. Eugene talked about the work of the Rwanda Development Organization and how they have shifted from sort of having in-person meetings to shifting to making more use of virtual meetings and webinars. And also about the greater emphasis on the use of media, on print media, on social media, and radio and television, and that was an effective way to get the message out to policymakers and also to the public at large. The Clean Cooking Association for Kenya also gave similar examples. They mentioned the need to shift to virtual meetings and the fact that this big stakeholder meeting had to be postponed or delayed. But it was nice to see that there's also some positive aspects too, that because of COVID-19, there's now an interest in funding some activities to help farmers and other households respond to COVID-19. And some of those funds can be used by the CSOs to promote their own to promote their causes, which overlap with the causes of the government, obviously. I think in Kenya, David mentioned this SME, small and micro enterprise stimulus funds, which can be used to to continue the activity of the CCAF. Let's see, and also the Institute for Economic Affairs also talked about adaptation. Again, the shift from virtual meetings to webinars and other forms of virtual communication with policymakers and with stakeholders. And obviously, if you're working in the area of sanitation, then the whole topic of hand washing becomes extremely important now, even more important than it was before. One more reason to wash hands and to maintain high levels of sanitation. I guess their message has been broadened a bit to not just focus on hand washing, but also to include social distancing and other measures which will slow or stop the spread of COVID-19. I think the sort of final recommendations that Kwame mentioned in terms of networking, continued advocacy, to seizing opportunities. I think these are messages which are very relevant for the CSOs in adapting to COVID-19 and maintaining the effectiveness of their operations in spite of the very challenging environment that we find ourselves in with COVID-19 in terms of difficulty of having physical meetings, movement restrictions, and other challenges to our activities. So let me just conclude by saying that I think these are very impressive responses to an unprecedented challenge. And it's very gratifying to see that the CSOs have been able to continue their work and to continue advocacy and to achieve challenges. I think Eugene mentioned that the funding for food and nutrition security had been increased in Rwanda and presumably in part due to their advocacy efforts. So it's very gratifying and to see that these CSOs have been able to respond to the challenge effectively and to continue their mission to promote food and nutrition security and WASH issues. So thank you very much. I really enjoyed the presentations and congratulate you all on your work.
So thank you, Nick. Nick has actually been one of the senior researchers that has accompanied this project, supporting various teams across the countries with the research work on food and nutrition security. And I agree with you absolutely, Nick, that civil society organizations have demonstrated great resilience. But it's also very interesting that a closer look at how this epidemic is unfolding, it is touching already on some of the areas that the civil society organizations have been working on. And the idea is then how do they maintain relevance, and also how do they maintain the gains that they have previously been able to accomplish. Thank you. We move on now and hear the observations by Micah. Welcome, Micah.
Hi, thanks, Mary. And let me start with a big thank you. Thank you for inspiring me, all the presenters. I was very inspired by the wealth of practical examples of how civil society organizations build trust between government and citizens in these bleak times. We all get a little bit depressed with Corona, with being inside, with seeing all the problems around the world. But what we have here is very powerful examples of civil society in action. This is not theory, this is action, and this is impact. Thank you, thank you, thank you for the inspiration. The COVID crisis demands collective sacrifices from communities. And it puts a lot of stress on societies and political systems. What we see around the world is that governments that have managed to limit the spread of the virus are those that enjoy the trust of their citizens. Long before Corona hit, They had a social compact in which members of society cooperate for social benefits and received support from governments. Civil societies play a critical role in this social compact by providing citizens with a strong and collective voice. It's all about that voice that we hear today. Let me make 4 observations when I listen to the presentations. The first one is on building relationships and building on the relationships. Then about the importance of evidence and data. Then a focus on inclusion, and lastly the power of new technology. Building on long-lasting relationships, all presenters showed how they use their long-term relationships with government to provide citizens with a strong voice, to hold officials accountable. Kwame Owino of IEA showed how a track record on constructive and critical engagement makes his organization a credible partner. It's very heartening to see how IEA was invited to be part of emergency committees by various local governments, and even Kwame talked about how the National Treasury of Kenya called upon IEA. It's really that kind of long-lasting relationship that in these kind of crises make civil societies effective advocates. And I think that was even in the case of IEA enhanced by working with local governments, not only on policy dialogue and advocacy, but also on distributing information on education and communication materials and on preventative measures. I think that's a great example of these long-term relationships. David Nguyi of the Clean Cooking Association gave another example of that. The members of the Clean Cooking Association of Kenya are explicitly working and visibly working with governments to provide basic services. Again, that provides the Clean Cooking Association with a seat at the table. Very impressive work. The second point is on the importance of data and evidence. I think all of the presenters mentioned that, as well as the first commentator. Civil society plays a critical role in sharing impartial data and evidence about Corona and its economic and social impacts to counter all the rumors and political manipulation that we see around us. I think Eugene Ribasira of the Rwanda Development Organization actually gave some really nice examples of how they developed evidence-based arguments to tackling malnutrition and advocating for public spending on food and nutrition security. I especially liked the public expenditure tracking instrument that he mentioned. It's one of my favorite and proves to be a very powerful tool of evidence-based advocacy. Kwame also mentioned social audits and public participation processes to highlight sanitation, other powerful tools to give citizens a voice and to leverage data and evidence. Inclusion is always important, but in this focus on inclusion, even more important now. The COVID crisis makes that hundreds of millions of people around the world see more poverty, see more hunger and destitution. We need to ensure that no one is left behind. And especially women and girls are hit the hardest by this crisis. The example from Rwanda was very impressive here. The idea that, you know, with the lockdowns and the lack of movement of people and goods reducing the quantity and variety of food available on the local markets, the government reacting to that by stepping up on providing food to the vulnerable populations, but then civil society finding out that the nutrient content was limited. Again, a long-standing partnership with various stakeholders was used to remind the government to include vulnerable groups such as pregnant, lactating mothers and young children, and also to make sure that the food that was given out was good and nutritious. I think there were similar stories from Kenya, the two speakers, how they used their seat at the table to advocate for access to energy and wash services for most vulnerable groups. That's what civil society is all about. I think the stories we heard about how new information technologies are leveraged to share impartial data and fight misinformation were also very inspiring. We've all been working increasingly on Zoom and on Skype and on all kinds of new technologies, but of course the lockdown and social distancing restrictions have accelerated the role of information technologies. I've been super impressed by how all partners around the world have scaled up digitized solutions and using them smartly. It's not about the technology, it's about people behind the technology. Again, the networks and relationships that already exist are the basis to bring about change. It's pretty amazing, even this webinar shows how we can contribute and continue to work in this new normal. Would we have done this in the same way and as productively before the corona crisis? So great work. I think we're showing that evidence-based advocacy through civil society plays a key role in support to governments to make sure there's an inclusive and sustainable recovery from the current pandemic. We need to continue to focus on fighting poverty in these hard times. Back to you, Mary.
Thank you, Micah. Thank you for your comments. And indeed, underpinning the role of civil society. It's not every day that we consider civil society along other institutions, government and private sector. And I think this is what this webinar needs to address, that civil society role, finding their feet quickly in the epidemic is very important in especially voicing the interests of the vulnerable people. So in that regard, without having to go over your comments, thank you for inspiration and the encouragement that you give us this afternoon for the civil society organizations. Now, one of the things you addressed was technology and the fact that we can do much more. But once in a while, we also get a hitch. So this afternoon, we've been trying to be in touch with our guest speaker, Jeroen Kelderhuis, Head of Civil Society and Education Division, Dutch Ministry of Foreign Affairs. And he has made an effort to have his message for us recorded. So I'm giving it over to my colleagues to give us the remarks of Jeroen.
MS Teams. Dear participants, I'm sorry I couldn't connect to MS Teams, but I'll do it through this video. On 11 March 2020, the World Health Organization declared COVID-19 Dear participants, I'm sorry I couldn't connect to MS Teams, but I'll do it through this video. On 11 March 2020, the World Health Organization declared COVID-19 a pandemic. Governments all over the world declared measures to curb the spread of the disease, including travel restrictions, nighttime curfews, the banning of large gatherings, and social distancing. As you know, these measures had swift and dramatic social and economic consequences for all sectors of society, including civil society organizations. The pandemic also exposed entrenched inequalities, widespread discrimination, structural inequalities, historical injustices, lack of access to health care and other basic services, vulnerability of workers, fragile or wholly inadequate health systems, and increasing domestic violence. However, in time it became clear that CSOs working on the front line of many of these issues, either providing essential services or documenting and advocating policy change, responded to this crisis by providing healthcare, food, shelter, and other essentials to those in need. Civil society, as much as possible, continued to work to hold governments to account, often in difficult circumstances and conditions, asking probing questions about the quality of response, highlighting failings, insisting that rights be respected, making the voices of the most excluded people heard, and any restrictions of freedom be temporary. The COVID-19 crisis once again demonstrated the vital needs of civil society and the important role it has to play. But it also became clear that at a time when the contribution of CSOs is more critical than ever, they are also confronted with the negative impact of the pandemic on their operations and sustainability, like facing a new wave of rights restrictions, many of them opportunistically imposed under the guise of pandemic response to claw back freedoms and consolidate ruling power, but also loss of funding, cancelled or reduced operations, reduced number of staff members, increased workloads, increased uncertainty about the future, and dealing with difficult issues such as increased domestic violence. Our world already faced tremendous challenges: limited human rights and democracy, economic failure, inequality, multilateral dysfunction, and the climate crisis before the virus struck. The challenge is not to get back to old ways, but to push forward to a new normal, a post-pandemic world that is fairer and more equal, and in which rights are widely recognized. An urgent and comprehensive public debate and transparent consultations on exit strategies and recovery measures are highly needed. The question of whether recovery will need to be more inclusive, just, sustainable, and democratic societies depends, in my opinion, fundamentally on the participation of civil society in this process. The current Voice for Change project has been a good example of how CSOs can contribute to thematic goals such as food safety and nutrition, WASH, resilience and sustainable energy, and place them on the policy agendas, not only in good times, but also in the bad times as well. In relation to COVID-19, hand washing with soap, personal hygiene, including access to cleaning water and sanitation, WASH, is a proven first line of defense to stop COVID-19. Therefore, our ministry recently contributed an additional €7.5 million to UNICEF's WASH program in the Dutch response to the COVID-19 outbreak. However, next to WASH aspects, also the food and nutrition security situation in Africa remains worrisome. It is clear that food and nutrition security is at this point in time not threatened by a worldwide food shortage, but by a decreased access to especially nutritious foods due to severely reduced purchasing power and market failures. Therefore, the role of CSOs in relation to national and local governments is crucial to get markets functioning again. Due to this reason, the Netherlands will continue to support the CSOs to contribute to the realization of the SDGs. I'm very interested in the way you as CSOs survived during the pandemic and in the way you were able to adapt your program, your activities, etc. We as government officials and headquarters staff can learn a lot of the way you were confronted with the pandemic and how your organization responds to this very difficult situation. Your experience and insights will help us better responding to the needs and questions of CSOs. My intention for this seminar was to listen, and I will continue to do so. And thank you very much for participating in this inspiring seminar.
Thank you. Thank you, Jeroen. And we'll make a point to ensure that, of course, Jeroen receives a recording of this presentation. We really appreciate his effort, really going out of his way to record and share with us his commitment, but also the fact that he inspires us to look forward to interacting with this new normal. And I think, as somebody said, the world is changed by those who turn up. And in this case, civil society roles continues to be very important in representing the perspective of their constituents. And those are the communities in the grassroots, as we call them. We'll move now, as we move towards closure, to listening to particular perspective of the CSOs. So in this case, I will invite Kwame Owino from the Institute of Economic Affairs. Kwame, in your presentation, you mentioned that you have enjoyed collaborative approach working with government. And at the same time, we have seen your civil society organizations in the front line providing critical feedback to government. How do you manage this balance? Share with us your experiences. Thank you. Kwame, you need to unmute.
Okay, thank you very much, Mary. Thanks. I think there are no tricks. The point about this is that we think we are lucky in the sense that first, Kenya has many development and political challenges, but we have a constitutional order. That constitutional order allows for independent groups such as the IEA to participate in public affairs through a constitutional provision in the Bill of Rights. So that's the basis upon which we act. So for that reason, we very positively approach departments of the state, and in our view, the most important one for the purposes of the work that we're doing at Voices for Change is one, the Ministry of Water and Sanitation on one side, and the second one is the Ministry of Finance because of the budget, budgets. So we don't have a problem writing letters because government of Kenya likes to record everything in terms of letters and asking to be involved in these affairs. And every so often, they ask us to present our views, and we try to. The deadlines are usually tight, but the most important thing is to just build credibility by showing that, look, we have an independent role. Part of that is to give you the critical views that come from voices that you otherwise would not hear. And more importantly, we would want for government to do better. So we are not looking at you, we don't want you to fail. We want to provide you with the perspectives of a diverse set of people whom you would not hear from, and that's how our partners come in. So what we think of ourselves is as a bridge. We have partners even in this process. Those partners provide information for us, which we can then synthesize and provide to government as well. Sometimes it's very effective, otherwise it's not. But on the whole, because I've worked in this for a long time, I think it's just getting better, and it's upon us as well to make sure that those links that we make with specific officers and also with specific departments of government continue to grow stronger. So as I say, there are no tricks here and there. It's actually just testing everything, but using the formal methods as well as the informal methods to make sure that government recognizes that an institution exists. We provide credible information, but at the same time, we provide whatever correction we can. I mean, we call them we call it independent analysis, which helps to make public affairs stronger. And that's all. Thanks.
A follow-up question for you, Kwame. The positioning of civil society organizations. How do you see civil society organizations sustaining their mandate, especially when they're purely depending on grants and with an additional crisis presented by COVID? How do you see yourselves positioned in the future?
Well, the question of self-sustenance will be, I think in my view, it's something that civil society groups or rather, let me say that as the Institute of Economic Affairs, my job description says the first item in my job description is to maintain the fiscal solvency of the Institute of Economic Affairs. So what I worry about every day is basically how we can, one, diversify the sources of income that's available for us. So the first one that's available for us is that we are an organization with members. So our mandate derives from our members. We have about 140 members who pay a subscription every year. So that's the first thing. So we have to make sure that our members actually have some skin in the game. So that's one. The second is also to diversify the sources of our revenues, basically making sure that we have ways of checking up and trying to ensure that both locally and globally we are able to provide that. But coming specifically to COVID-19, we think that, yes, it's a risky environment because what will happen is that most resources will be diverted towards helping government and specifically the public sector to respond. So our analysis, whether it's budget analysis, trade policy analysis, regulation analysis, and public finance in general, must be about how to help government to respond to ensure that the recovery is faster. So it's basically that nimbleness and that flexibility that is something that we must put into this new challenging environment. But our view about think tanks and civil society groups in general is that the ground we walk on will forever be slippery. And what it means is that we must have the kind of skills that allow us to respond in every way, definitely in every environment that we do. So risk analysis is a capability that we must always have at the back of our minds. Yeah.
Thanks, Kwame. Thanks for that and for sharing with us your experiences. I don't know whether Nick or Micah, you have any final comments in regard to this discussion.
I don't have any prepared comments, but I just wanted to say that I really appreciated listening to the experiences of the CSOs and hearing about both their initial efforts to work for their respective causes, but also the way in which they have adapted to the many different challenges associated with COVID-19. And I agree with the others, with what Jerome and Micah said, that it's very inspiring to see how they've been able to overcome these challenges and continue to be effective even in this environment. So it's been very interesting and enlightening for me to see more of the detail about the response to COVID-19. So I congratulate them on their efforts and wish them all the best in the future.
Mary, let me take it from there, and I have little to add to what everybody has said. Thanks for the inspiration again. The corona crisis put millions back into poverty and into hunger and into destitutions. The work that civil society is doing around the world on evidence-based advocacy is more relevant, more important, but also more difficult in those times. And it's very, very nice to see those experiences of how in these dire circumstances, the power of voice becomes stronger rather than weaker. I liked what Kwame said at the end. There are no tricks. This is hard work. This builds on long-lasting relationships. It builds on a lot of work which has been done by all these actors for years, but we are bearing the fruits and we're really making a difference in the societies we work in. So till we meet again, and hopefully the next time that would be physically, even if socially distanced, because I love all these new technologies, but something is missing. So thanks very much. Evidence-based advocacy for poverty reduction, now more important than ever.
Thanks, Micah. I wish to acknowledge Frida. Frida Kithuku is Chief Executive for Roots Kenya. It's a grassroots movement. We worked with them very closely on this project, and they have been very instrumental on pushing policy changes at the community level. Unfortunately, for some reason, she's been unable to attend and was going to be making remarks on her front. So we appreciate her, even as much as she is not able to be here. And I, at this moment, would like to move to the closing remarks by Micah, as I appreciate everybody that has been on this call. And yeah, Micah, pick it up from there, and then I will do a final announcement.
Mary, I'm giving it back to you. I said that, that poverty reduction and evidence-based advocacy is more important than ever, and let's go. And I think with that, I'll give it back to you for your closing and your announcements. Thanks.
Thank you very much. Thank you for joining us, Micah. Thank you, Nick. And I can't thank Jeroen more for his efforts going out of his way to give us his message. And for all the participants that are listening to us, this is not the end of the conversation. As a matter of fact, it's the start of the conversation. Wherever you're working, please keep in mind the role of civil society organizations. We have seen the work that they are doing, and let's continue to support them. So keep posted on your registration link, get in touch through SNV, and get a recording of this presentation in the coming days, and let's keep connected. Thank you, everybody, and bye-bye, and thanks for joining us. Goodbye.
Thank you, Mary, for moderating.
Thank you. Bye.
Bye-bye.
Bye. Bye.